Welcome back. This is Dr. DeShavo with Chapter 7, Part 2, looking at urinary function. So don't forget these hormonal influences. I'm going to zip through this because I believe we have done this at least once, if not twice before. Antidiuretic hormone is going to be released from the posterior pituitary in the brain. We'll look at that when we get into neuro. And that helps to retain fluid because it is an antidiuretic. Aldosterone is released in an attempt to retain salt. If we retain salt, we retain water. Now, we also have renin, angiotensin, aldosterone system, which aldosterone is linked in with, obviously, but I put it on its own to review what it does specifically. So don't forget, renin is going to start the conversion of angiotensinogen to angiotensin 1 to angiotensin 2. Angiotensin 2 will release aldosterone, but it also is a vasoconstrictor itself. So all of these hormonal influences begin with some stimulation from the kidneys. Additionally, don't forget erythropoietin will be released from the kidneys in order to stimulate the creation of red blood cells. Waste products that pass through the kidneys. Now, hopefully not ammonia. Okay, so ammonia is actually going to be a byproduct of breaking down protein. When we eat protein, we send it to the liver to be processed. The liver breaks it down, and one of the waste products that it creates is ammonia. Ammonia is very toxic in our system, so our system converts it very quickly to urea. And urea, will be secreted, into the urine. And the kidneys usually are pretty efficient in getting rid of that. If you're not getting rid of that, it can build up in the blood, and we test for it as BUN, right? Blood urea nitrogen, which I have listed a little bit later. I'm sure that sounds familiar. Now, uric acid can also be excreted through the urine. Uric acid will come from the metabolism of nitrogenous bases. And I have this listed, I believe, in the next slide. Here we go. So the ones, you don't need to know all of these, but you do need to know ammonia and then urea. So ammonia will happen in the liver. The liver pretty quickly converts it into urea. And then uric acid comes from really specific types of food that you can eat. This is what happens when people have gout. They have a buildup of this uric acid. So they should avoid meats. I think especially organ meats have a lot of uric acid in them. And they're nucleotides, which are part of DNA and RNA, that get broken down and they get turned into uric acid. And people who have gout have a buildup of that in the joints and or their liver. So we want to keep uric acid levels down as well as a sidebar, because that can be very stressful on the liver as well. Bile pigments. The rest of that, I want you to focus on the top 3 for now. The other ones we'll get into, or we already have gotten into when we get into the different systems, okay? So we convert vitamin D to its active form in the kidneys. We secrete bicarbonate, you know this. Excretes or retains hydrogen, you know this. Synthesizes erythropoietin and renin. Got it. Yay, Dr. D, something that makes sense. And it should say secrete or retains bicarbonate. I should say that in that second bullet point. Okay, so our blood test here, BUN, we just mentioned. So this is that protein metabolism. Remember that urea is a breakdown of protein, okay? And it's excreted by the kidneys. If the kidneys aren't filtering well, we'll have a higher BUN level. Serum creatinine. So this is a byproduct of muscle metabolism. When the muscles work, they're actually going to break down what's called creatine phosphate. When that's used, we have leftover creatinine, and that creatinine should be completely excreted through the kidneys. And this is actually why they use creatinine the 24-hour urine collection and clearance, because if you're given a certain amount of creatinine, you should get rid of almost 100% of that through your kidneys. If not, you may have some sort of damage in the kidneys. Urinalysis, I don't even need to tell you guys about that, right? Got your list of stuff there that you can check though. IVP, you actually give an injection and it creates a contrast medium inside so you could see the kidneys, kind of cool. PSA, prostate specific antigen, is a test that they'll do on males to make sure that they hopefully don't have cancer. I zip through those because I am guessing that's a little familiar to you. Any questions, let me know, but I have a question for you. The kidney functions include regulation, creation of red blood cells, regulation of acid base of the body, conversion of vitamin D to its active form, all of the above. Answer the question. You can pause if you need to. Let's move on. So urinary dysfunctions. What went wrong? Gosh, there's so much that can go wrong. Let's start with the basics. So urinary incontinence, there's a couple of different forms. Your book lists a whole bunch of forms. I'm just going to go over, I think, some of the most common. Enuresis, is involuntary urination by a child after 4 to 5 years of age. So your typical bedwetting child, some children wet themselves as well. Unfortunately, until they're a little bit older. Could be psychological, could just be structural, usually it just resolves itself, not a big stressor, right? Stress incontinence. So this is when there is like physical, not like I'm stressed out and I can't hold my urine, although that does hold some weight, but that's off topic. Okay. It's physical stress. So we'll see this in women when they're pregnant. They can't hold their urine because the uterus, if you look at the uterus, and we'll be looking at that in the next chapter, is right over the bladder. And that uterus grows from about a fist size all the way up to your xiphoid process under your rib cage. So, that uterus really stretches, but as it stretches up, it also pushes down and it pushes on the bladder. So stress incontinence is when something stressful happens to the bladder that puts pressure on it that causes us to leak urine. Okay, and it's not like a gross loss, it's just a little, little pee of the pants per se. Coughing, sneezing, laughing, exercising, lifting something heavy. As we get older, things break down. We have less control over those sphincters, but really we'll see this after women have had children. That pelvic basin and the urogenital diaphragm that we looked at gets so stretched and sometimes ripped. As you guys know, it's just not as efficient at keeping the urethra closed. Okay. Prostate removal, I should put that. Of course, I talk about pregnancy because I'm a woman, but let me just talk about prostate removal. Okay, prostate removal also. The prostate, don't forget, is around the part of the urethra, I should say, in the male, and prostate removal can actually damage that, so they may have difficulty as well. Okay. Neurogenic bladder is a bladder dysfunction caused by interruption of normal bladder innervation, brain, spinal cord injury, nervous system tumors, trauma. And the manifestations are overactive, underactive bladder. You can also add to that gross loss of bowel and or bladder. So I put in Cauda equina syndrome. This is probably in the neurology chapter, which I've not prepared yet, but I will, don't you worry. Cauda equina syndrome is damage to either the very lower lumbar spine or the sacral nerves that come out of the sacrum and go to the pelvic basin. In Cauda equina syndrome, this could be from a tumor, could be herniation, could be trauma, could be a broken sacrum, and it's very dangerous because the pressure that are put on those nerves, if it continues, can cause permanent nerve damage. And the signs and symptoms are gross loss of bowel or bladder. I'm sure you're all nodding your heads. If anybody has gross, and I don't mean disgusting, of course you know, by gross loss of bowel and bladder, I mean they have no control over holding their urine and holding their feces. And so that would be a very bad sign. And saddle anesthesia is people who have numbness anywhere in their genitals that would be touching a saddle. Saddle anesthesia, numbness and or tingling. Those are both signs and symptoms of cauda equina. Those are a surgical intervention that needs to be done immediately. So, question time. A patient who is urinated while laughing is worried that they might have cauda equina syndrome. You can consult, I'm sorry, I was trying not to laugh when I read this. You can console them by saying, hey, yes, you do, which, yeah, we should never do. B, maybe. C, cauda equina causes gross loss of urine and or feces, which means massive. Or D, cauda equina causes only loss of control of bowel. Okay, what would you say to them to console them? Okay, sorry, I had to laugh at, yeah, I gotta throw something funny in there every once in a while. Okay, so congenital disorders. So this is just a quick list of things that can happen. In a little bit, we're going to have a let's practice and look at some examples. So I'm not going to show you a lot of pictures, but we're going to go over pictures in just a little bit. So congenital disorders often occur with a reproductive abnormality. We're going to look at some of those. Hypospadias is an example. Kidney development begins about the 5th week of gestation. That's amazing to me. 5 weeks pregnant and systems are already being built. Urine is actually the main component of amniotic fluid. So, and we want to maintain good levels of that. So we want to stay hydrated so our little babies can create pee. There you go. Horseshoe kidney is a congenital disorder that I threw in there that your book did not have listed. And I'm throwing it in there because I've actually seen it twice in practice. Just as a sidebar, I sent patients out for x-rays and they came back with a horseshoe kidney. It is a total normal disorder, I guess you could even call it. The kidneys don't separate. You have one big kidney across the back, and it never causes them a problem. It's just a coincidental finding. So UTIs are extremely common, and the lower tract is the most frequent site. E. coli is the most common culprit because that's living in our colon. Remember that we have different types of bacteria that are quarantined, per se, into different areas of the body. E. coli is one of them. E. coli is in our colon, and it needs to stay in that part of our body because it's very dangerous in other areas. E. coli is. If you were to ingest it, that would be awful. Okay? So, if a woman doesn't wipe properly and wipes from back to front, she can drab that E. coli into the vagina and also to the urethral meatus. Okay, so female BPH, which is benign prostatic hypertrophy, we're going to go over that, and improper personal hygiene. Signs, maybe asymptomatic, could be urgency without voiding. I've heard that with people with UTIs, and cloudy urine. Cystitis is an inflammation of the bladder. The bladder and urethral walls will become red and swollen. It could be infection, irritants, same as UTI syndromes or symptoms. Okay, so get your thinking caps on because we have to go over glomerulonephritis. So, okay, you already know the definition and what it means. Itis means inflammation. Glomerulonephritis is going to be inflammation in the glomeruli and the nephrons. Done. Okay, it's usually bilateral. It may follow a strep infection. Okay, one of them does, one of them doesn't. I have 2 of them listed for you. Leading cause of renal failure, so we definitely want to get it checked out. There's nephrotic and nephritic syndromes. While we're here, I just want to talk about flank pain. And flank pain, I'm sure we all remember, is in that lower thoracic, so like T12 through L1, L2 regions to the side. And flank pain, we always want to think kidney, right? That is the area that we will have discomfort if we have a kidney issue. Okay, that being said, we're going to look at 2 forms of glomerulonephritis. So, the first is nephrotic syndrome. And this will be damage to the membrane that we looked at, that Bowman's capsule that is around the glomerulus. can be caused by autoimmune diseases. Now, what I think is more important is if we look, we have O's, nephrotic syndrome, and I tried to make everything an O that you need to remember. There's a lot of proteins that are dumped into the urine, giving it a frothy appearance. They have hypoalbuminemia. This is one of those days where I can't talk again. The liver responds, so we have albumin decreased in the bloodstream. There you go. And the liver responds actually by increasing lipids in the blood. It's trying to balance the solutes in the blood. So if we have low levels of albumin, it'll actually secrete the liver. They'll secrete lipids to try to balance out the concentrations. Albumin is one of the main proteins that we'll have in the bloodstream that helps to regulate the control of fluids in the body. That albumin, as well as sodium as well, helps to retain fluids. Okay, so with this case, we'll be getting rid of albumin, okay, and dumping it into the urine. Because we dump albumin into the urine, we don't have as much albumin in the bloodstream. Okay, albumin, I should clarify that a little clearer, is the main protein that keeps fluid in the bloodstream, not in the body. So if we don't have enough albumin in the bloodstream, fluid will leave the bloodstream and go into our tissues. Okay, so with that, the patient will have edema. The edema likes to begin periorbital, that O again. Okay, so around the eyes, and that'll lead to systemic edema. Okay, we can actually have clots as a byproduct of this as well. So nephrotic, all those O's to try to remember. Now, nephritic syndrome, so ITIC or ITIS references inflammation. So this is an inflammation that will injure the glomerulus, and this may be post-strep. Okay, so that strep will cause an inflammation that'll attack the glomeruli. It breaks the glomeruli. Don't forget, the glomeruli are capillaries. Those capillaries are simply cells that line those capillaries. Some of those cells actually will get destroyed and split apart, so it's easier for substances to sneak across and get put into the urine. Okay, so white blood cells may actually be in the urine. If they have a low urine output, they actually have hypertension because the kidneys are not filtering enough blood, so they'll increase systemic blood pressure to try to get more blood back. Okay, so nephritic syndrome. Here's a picture. We have inflammation on the left with nephritic syndrome, hypertension, cola-colored urine, hematuria, okay, oliguria. We have decreased urine output, as opposed to the O's, okay, decreased albumin, increased lipids, proteinuria. I have no idea why they have a dog licking the urine. I don't know. Maybe he's thinking he's going to get, always trying to get protein from it to get stronger. Got it. Peripheral edema that will start periorbital. Some of my students have said this helps them, so I threw it in there for you. This picture, once again, lists them again. It seems to me like they sort of hit this hard with kidneys, possibly with your boards. So I was trying to put together a couple of different lists that would make it easy to remember these things. Okay, so there it is again from a different angle. So let's practice some of these. Can you guess what condition may cause this? Nephritic syndrome, creating that Coca-Cola, I guess just cola-colored urine. I don't know if you could use Coke anymore. Okay, is that a trademark? What do you think? All the O's, right? Pitting edema. And this, of course, can be caused by other things, but we're talking about these kidney diseases is what I'm getting at. Okay? This would be nephrotic syndrome. Okay, starting periorbital, moving into the extremities. Isn't that cool? It's a cool picture. You're probably like, I know what that is, right? There's your horseshoe kidneys. So they create that horseshoe-like presentation instead of separating. They've just melded together in that patient, okay? Wow, it's not beer. It's not beer. Don't drink it. Right? Nephrotic urine. That cloudy, frothy, I should say, urine. All right. Looking at pyelonephritis. So this is an infection that's reached the kidneys and gone out to the cortex. It's gone right through. E. coli gets into the urethral meatus, works its way up, okay, and has reached the kidneys. So they can become very filled with fluid and exudate, compressing the renal artery. You can get abscesses, you could get necrosis, can be acute or chronic. So this can obviously lead to renal failure, recurrent UTIs, and obviously some toxicity, okay? Severe UTI syndromes or symptoms, flank pain, increased blood pressure, because if we have inflammation in the kidneys, we can't get blood into them to get filtered. Your body is not filtering enough. It senses that decreased filtration and sends more blood towards the kidneys. So it gets to be a really wicked cycle. NEPHROLITHIASIS is just kidney stones, okay? There's different types of kidney stones that can form. Hopefully they're small and they'll pass and not be too difficult. Sometimes they can be pretty large, okay? And they can actually fill the pelvis, believe it or not, and all the way up to the calyces. It's crazy. So it can have calcium in combination with phosphate, I think, is going to be one of the most common ones. Oxalate is another form, okay? Hydronephrosis, abnormal dilation of the renal pelvis and the calyces of one or both kidneys. So this could be tumors blocking the way, or it could be BPH blocking the urine from leaving, or stenosis of the ureters. This could be unilateral, which means one-sided. It could be bilateral, God forbid, okay? So unilateral would be something that is above the bladder. It would be that single-sided ureter or something higher. Bilateral would be bladder down to urethra, okay? And that would back up both sides. So you could get atrophy, cell death, glomerular filtration cessation, have that flank pain, just flank pain, always back to flank pain. Okay, WILMS tumor is also known as nephroblastoma. It's a rare cancer. Can occur in one, can occur in both. There is a genetic component. There's a condition I'll talk about in the next slide or two. Okay, so this could be by itself, can happen in utero, or it could be a series of complex steps with Wagner syndrome. I'll show you in just a minute. Okay, so here's WAGR syndrome. I have a nice video for you about it because this WILMS tumor can actually have a genetic link with a missing iris, one-sided increase in kidney size, and urinary tract abnormalities. Okay, so it can be part of a whole syndrome, WAGR, Wagner syndrome. So please watch that video about that. Long-term survival rate is very excellent with early detection and treatment with this WILMS tumor. So asymptomatic abdominal mass. If we have any mass anywhere that is not painful, we need to have it checked. Okay, that's why I left that in there. High blood pressure once again, because that tumor is going to take over some of the tissue that filters our blood. The body senses not enough blood is being filtered. It sends more blood to the kidney. It increases blood pressure. We're going to dump blood into the urine, and we might have more urinary tract infections with the WILMS tumor. Okay, so let's practice these and then we will take a little break. Okay, what do you think this is out of those last few diseases that we looked at? Yep, hydronephrosis. That one was probably pretty easy. This is a cool picture. I feel bad for them, but it's a cool picture. Now, this is, you probably guessed right, okay, it's what's called a Staghorn calculus. And these will be kidney stones that keep culminating, and they'll actually fill the calyces in the pelvis. And you could see the renal pelvis. You can see them on the x-ray because of the calcium that makes them up. And they look like a staghorn because of their shape. I thought that was kind of cool. And that was back in the notes, but I'm not sure I went over it. So I apologize about that. What do you think? This might be a little hard. Okay, WILMS tumor. See on the top part where it's a little whitish. What do you think? We have some repeats here. Okay, hydronephrosis again. So you could see the dilatation into the kidney itself. The one that we looked at earlier is going to be a distension of the renal pelvis. This one should be easy peasy. Those are actual little kidney stones. Okay, or renal calculi. All right, at this point, I'm going to take a little break, and then we will finish up this lecture in the next video. Thank you so much. As always, if you have any questions, shoot me an email. I'll be happy to get back to you. Take care.